Is your child keeping the food for a longer period of time in the mouth, or is having difficulty in chewing and you still are feeding your child with mashed food or the food which is completely mixed in the mixer? So this is a very common problem among the kids with autism, and sometimes with some kids with language and communication problems, that they have feeding issues. They have difficulty in chewing, they have difficulty in swallowing, and that's why even till 5 years of age, 6 years of age, the parents are continuously mashing the food and giving, and the child is able to eat by just gulping it. What is the main cause of chewing difficulty? The first cause of chewing difficulty is that the child is having oromotor sensory issues. So anything that changes the texture or that changes the environment of the mouth, the child is not able to bear, and that's why he avoids change in textures. One texture what he has learned at the infant stage or at 2 years of age, that is the mashed food, he likes only that texture and he continues to like to use that texture to swallow or to eat. And the second issue is they have difficulty in chewing. That means the jaw strength or the jaw motor movements are not enough to chew and swallow the food. So for both these issues, the first thing you should try about is oral placement therapy. In that, the first step what we solve is the oromotor sensory issues. So once the problem of the oromotor sensory issue is solved, the child is able to bear different textures in the mouth. So at least one problem is solved, that is the texture problem is solved, and the child is able to bear hard, soft, semi-soft, semi-hard textures in the mouth. The second problem that is solved in oral placement therapy is the jaw strength. There are a lot of exercises, there are a lot of jaw strengthening exercises that are done in oral placement therapy, which basically helps to strengthen the jaw, to use the jaw to chew things. Once they start getting that strength and the motor activity to chew, we use different types of food items, be it soft, be it finger foods, be it hard foods. We start increasing the texture, we start using complex textures and give that exercise to the child, and the child starts chewing after the jaw strength is gained. So we solve the oromotor sensory issue, we solve the jaw strengthening issue, which will help the child to chew, and secondly it will help the child to bear the texture, so the child will be able to swallow. Sometimes these kids can also have a difficulty in swallowing. That means the more harder or a little bit bigger morsel of food or a solid food, the child is not able to swallow and he is gagging and he is vomiting. For this, there are some exercises that an occupational therapist or who work on the oromotor issues do, which actually strengthens the gag reflex, and that's how the child is able to swallow the food. So the therapy required for this is basically oral placement therapy and a little bit combination of occupational therapy that can work on the oromotor issues. Thank you.